This video will provide guidance on uploading COVID-19 point of care test results into the NHSN point of care or POC test reporting tool for long-term care facilities. The video will identify and review the tools and resources available to long-term care facilities reporting POC test results to the National Healthcare Safety Network and provide URLs for locating those resources. During the video, a successful upload of POC test data will be demonstrated. Additionally, an unsuccessful upload of POC test data will be presented with explanation and demonstration of correction of the aberrant data file and subsequent successful upload. Finally, instructions will be provided for how to obtain assistance with uploading issues. The URL provided at the upper right of this slide is one that you will want to bookmark. It is the NHSN COVID-19 website for long-term care facilities and is a one-stop shop for resources for all COVID reporting for these facilities. Among the most useful documents for facilities is the POC Frequently Asked Questions, or FAQ document indicated here. This document provides not only text, but oodles of screenshots for the NHSN application that can be immensely helpful as you navigate through the POC test reporting tool. There is a question related to CSV upload of POC results. We will look at that a little later. After April 15th, 2021, also located on this page, although a little further down, will be two other resource documents for the upload process. They will appear immediately under the Point of Care Upload Resources header, here circled in red. One will be called the Template for CSV Upload of POC COVID-19 data, not using direct. It will be an Excel file, which will contain headers that can be used by your facility for your upload file, if you so choose. The other will be called File Layout for CSV Upload of POC COVID-19 data, not using direct. These documents are the same as those that will immediately follow them and that have the same names except for the inclusion of the word direct. They're already posted to the website, and as you can see here. They're used currently for a different process for uploading POC data. If you would like more information about direct, you may send an email to nhsncda@cdc.gov. Once again, that's nhsncda@cdc.gov. One resource for CSV upload that's already posted to this page, as it's used for uploading staff demographic data to the POC test reporting tool, is the file titled State, Territory, County Codes for the US. It appears just below where a screenshot ends here. And we'll look at all four of these files now. First, we'll look at the version of the POC FAQ, which will be posted to the website on Friday morning. Scroll down. This is where you will find the POC FAQ, which I identified earlier. That document won't be updated until Friday. So we are going to look at an updated version. I have already scrolled down to page 17, which starts the question, can I upload POC test results to NHSN? The document provides an extensive step-by-step answer. So let's look at that. Can I upload POC test results to NHSN? Yes, you can upload POC test results via a comma-separated value or CSV file. To do so, save the data in a CSV file format that is in accordance with the file layout for CSV import long-term care COVID-19 POC test results found in the importing data resources section at this location. And we provided a link. Once your file is prepared, first of all, verify the org ID and CLIA ID numbers match the files to be uploaded. This is a screenshot here from the information that can be found in the facility option in the left-hand navigation bar or sidebar within NHSN. Your CLIA identification number is a 10-digit number. The first two are numerals. The third character is the letter D, and the next 7 characters are all numerals also. Your facility org ID number will also be found in the facility information section of NHSN. Next, select the COVID-19 on the sidebar. Select the POC test result reporting. From here, select Upload CSV. The Upload CSV file pop-up window displays. Select Browse. From here, browse to where you may find and then select the CSV file which you had previously prepared to upload. Click the Upload CSV. If the file has no errors, you will get an upload success message. You will want to verify that the record is uploaded. On the POC test result reporting, select Find Resident Staff Visitor. That tab is located on the top right of the page. Enter the ID or name that you're searching for in the appropriate field and verify that the record is correct. If there are errors in the data which you are uploading to NHSN, you will encounter the CSV Upload errors screen. The lines of data containing errors will be identified and the field containing the errors indicated. It's suggested that you print a copy of the errors so that you can correct them. To do so, use the print screen key on your keyboard to capture all of the records that have errors. Note, you can adjust the numbers of lines that are shown on the screen, and you may need to print more than one screen. Once this is completed, select Cancel, return to the data file, correct all incorrect data, and then restart the CSV upload process. Once all errors are corrected, the file will successfully upload. Note, if an incorrect file type or a blank CSV file is uploaded, you will receive the same error message, but no errors will display. You should upload a CSV file, provide a CSV file with data. So once this video has been uploaded to the NHSN website, you will have two places that you can find information or step-by-step guidance on how to upload a CSV file. This video and the POC FAQ document. Now, let's look at the template for CSV upload of the POC COVID-19 data, not using direct. Now, again, today, we are going to look at the version that's posted on the website for downloading via direct. And that's because it's already posted and it is actually basically the same as for a CSV upload. So it just has a different title. So we can look at it. And so it is right here. As I mentioned, the template and the file layout for CSV upload, not using direct, after Friday will be located just above these two documents. But first, let's look at the template for CSV upload of POC COVID-19. POC data. As you can see, it's an Excel file, which has columns with column headers, which can be expanded to provide a little bit more information if it's not clear. And some of them are still truncated once you expand them. You'll have a results version, an a date results released, the org ID, CLIA ID, staff ID, resident ID, visitor ID, given name, middle name, surname, date of birth, gender, race, ethnicity, address 1, address 2, city, state, zip code, if there's a zip code extension, county, country, home phone extension. There is one. The test order, the test order date, the point of care device, the test ordered, the specimen type, the result of the test, the specimen ID, whether or not the individual tested was symptomatic for COVID-19, whether or not they were pregnant, and then finally information about the physician's given name, physician's surname, their address 1, address 2, and of course address 1 would be their street name, address 2 would be if there is anything like an apartment number. Oops. Correct. Physician city, the zip code for the physician. There's a zip code extension. Their work phone. And if there's a work phone extension. So those are all of your data fields. The data has to obviously appear in this order that's listed here. Next, let's look at the file layout for the CSV upload. Of POC COVID-19 data. Again, the version will say not using direct, but we're going to look at the one that says via direct for now. It is basically the same file layout. This file should be used by the person that's creating your CSV file to ensure that the file will upload properly. It will provide the details about what data should be included in the template and in what format. If you encounter error messages about bad data when you're uploading the file, it's also one of the documents which should be referenced to determine if the correct formatting was used for the errant data fields or what format needs to be used. So as you can see, and this is where this will be a little bit different. Just in the header, it will just say for facilities, but not groups. And it will actually say for 9.5.3 and going forward, and not using direct. But the data fields and the requirements will all be the same for CSV upload. So the results version is basically whether or not it's a number 1 through, can keep, I don't know if there's actually a limit, but a 1 is the initial test. If you end up retesting a patient for, let's say you, the first one, you are correcting, let's say you're correcting the result, that correction becomes a 2. Maybe you accidentally reported it as positive, but it's negative. That's when you would report the second one as a 2. Otherwise, all first results are a 1. The date that the results are released, this is an optional field. You would only use it if you do not provide a results version. The org ID, you see that each of these fields tells you whether or not is indicated whether it's required or not, and then the formats. For instance, the org ID has to be 5 characters, and it must be a valid facility ID number for NHSN. The CLIA ID, as I mentioned, and you will see that the CSV file is going to be a little more updated than this file. It's going to tell you again that it's 10 characters, and the first 2 are numerals, and it's a letter D, and then it's 7 more numerals. So it has a little bit more information than this one has. The staff ID is conditional. It's not required, because if it's the individual is a resident, then you're going to be required to report the resident ID. Vice versa, if it's a staff person, you have to report the staff ID. Given name, middle name, surname. Obviously, middle name is optional. Date of birth is a required field. Gender is required. Race is required. Here are the codes that are acceptable for race. Ethnicity is also required. There are 2 options for race at this point. I'm sorry, for ethnicity at this point, HISP or no HISP. Address, information for that. City, state, and you'll find here also that we have states for the bordering Canadian provinces or the Mexican states, because we do have some facilities that border Canada or Mexico that have either staff that are crossing the border to work in American facilities or visitors that are coming over to visit patients or residents. So those are important to have. So this is where you would find those abbreviations. Zip codes. Just to go back, obviously zip codes are going to be different for maybe for Canada or for Mexico. Actually, for Mexico, it's a 5-numbered like it is in the US, but in Canada, it's 3 alpha numerics followed by space, and then 3 more alpha numerics, and we give you an example. Country, Canada, Mexico, or the US. County, we'll talk a little bit more about this. Each of the counties will have their own unique code, and we have another document that you will have available for that. And then this is where you will find the abbreviations for the individual point of care devices. It'd be important to make sure that those are abbreviated correctly. The tests that are ordered may be notated as ordered for each of the individual devices. They are device specific, so you'll want to get those correct. The specimen types, obviously, for instance, Binax Now only has nasal swab. You cannot report a nasopharyngeal swab for Binax Now, so those have to be entered correctly. And the results are also device specific. Some of them are POS for positive, and others may say positive spelled out. We match them directly to what is displayed on the device because we didn't want people to be confused. Specimen ID, and then symptomatic. I think the rest of these are pretty self-explanatory. So this is a pretty important document. So finally, the last document that I want to review with you is the document which is currently posted to the site, and it's the state, territory, county codes for US. This document provides further information, specifically the codes for the counties of residents, which are part of the demographic data. Each county has a 5-character alphanumeric code assigned to it, consisting of the state abbreviation and 3 digits. And there is also an abbreviation for facilities of the armed forces, as you can see here, AA or AE, depending on where the armed forces are located. So as you can see, all of the states are listed here in alphabetical order with their counties. So now we would like to go and demonstrate for you a successful and then an unsuccessful upload, CSV upload. I have a little problem here with my going to my facility. We're going to actually be in an environment it's a test environment or development environment of NHSN. So it's going to look a little bit different than what you are used to seeing. And that's because, you know, these the CSV upload option has not yet been released to production. So, you know, I'll show you where some of the words are not actually, you will not be seeing those. So we're going to go to the POC test reporting tool and the COVID-19 POC test result reporting. And you'll see here, I have some words, development only. These options you will not see. They're just in our development. So please just ignore those. So we're, you know, obviously creating this video prior to production in order to get it to you as quickly as possible. So to begin our upload, we're going to choose Upload CSV. Then we're going to choose File. And I'm going to then go to the file that I want. And I obviously have here one that I marked as successful, where I knew all of the data is good. And it has loaded it here, listed it here. So all I have to do is to say upload CSV. And there's only 3 or 5 records here. And you see that it says it's validating 2 of 5 records and that it successfully uploaded the CSV. I can say okay. And then I can go to the list and find the list. And I know that one of the individuals that I uploaded was Mr. Bustamoo. So I can find him and I can say, oh yes, here he is. There's the information that I uploaded. So I know that he uploaded correctly. Another way that I could do that, of course, to check is that I could go to my analysis and generate data sets so that all of the information that I had just uploaded was included in my reports. And then I could go to reports and I could run a line list for residents, for staff, and for visitors to see and make sure that they're all in there. So I have 2 options, 2 ways that I can look to make sure that the data is correct. So let's look at what it looks like if I am unsuccessful, if I have some errors in my data. Again, I'm going to go to upload the CSV. And I am going to choose a file. And I have a file here that is unsuccessful. So I'm going to choose that. I know I have some data in here that's not good. So let's see what happens when I upload that data. It tells me that it's validated 3. I had 3 files, 3 lines of data in there. And you can see that it's giving me some information that says, oh, they didn't upload any of the data. Please correct the errors below and resubmit the CSV file. It's giving me the person ID so I can know who it is. And I happen to know that my staff people, I give number IDs to. So this is a staff person. This is either a resident or a visitor, Betty Rubble. And then I have Peter Pumpkin Eater here. He actually is a visitor. I know he's a visitor. And it also gives me the specimen IDs that go along with it. It tells me the field that has incorrect data in it and a message. So in this case, the device name is not valid. And additionally, the specimen source is not valid for that same person. The test ordered is not valid. The test result is not valid. And the specimen number is not, has been used for another POC test result. So currently what happens is, and I know what the data error was here, I misspelled the POC device Acula. Instead of spelling it ACCULA, I spelled it ACULA. Once the device name is misspelled, then none of these are going to match up to it. So that's why it's telling me all of these are in error. So once I fix that, I should be good. Betty Rubble is telling me that the test result is not valid. So we can take a look at that. And that the specimen number has been used for another POC test result. And then finally, Peter Pumpkin Eater, the date of birth is an invalid date. So we'll have to look at that. So we will want to somehow take a picture of this or print this out so that we can be aware. And there's a couple of ways that we could do this. One would be to use the print screen option. And you might also use the snippet tool if you have that. And so I'm going to use the print screen, but I actually have something called Snagit on my screen, which when I use this print screen, I get this. So I'm going to take a picture of it and I'm going to copy it all and I'm going to go ahead and print this off. So the reason for doing that is when I leave the screen, I'm not going to have any record of what is wrong. So I want to capture what's wrong so that I can go back and fix it. So once I know I've captured what it is, I'm going to choose cancel. That means I'm canceling the upload. And now what I need to do is I need to go back to that file. And I need to fix that data. So I've got to go back in and find it. Pulling that up right now. And so staff ID 15, the device name was incorrect, it said. So I'm going to scroll over here and you can see that, yeah, Acula is actually spelled correctly here, A-C-C-U-L-A, but here it only has one C. So I'm going to fix that. And it also told me that the specimen number was assigned to someone else. I'm not sure if this is going to fix that. It may fix this when I go to re-enter it. We'll see. If it doesn't, I'll have to come back and assign this a different specimen number. Not actually quite sure about that. It also told me that Peter Pumpkin Eater's date of birth was incorrect. And so we're going to just go ahead and enter it. Let's say it was 12, 13, 20, 18. He was a visitor. I know that the error here was that I had not used slashes. So you do need to use your slashes. And then the Betty Rubble, it told me that the test result was incorrect. So let's go down here to the test result. So for some reason, it's telling me that the binax I had negative. So let's go back to the website and go to the file layout for binax now and see what the options are for results. POS or NEG. And I have negative in there, so I have to just make that an NEG and save that. So you should now be able to re-upload these and they should be fine. My only question is the specimen number. So let's specimen ID number. So let's give this a shot. Choose the file. Oh, it's telling me that 15 specimen source is not valid. Let's go take a look at that. And then that I'm going to have to do something about the specimen ID number for that one and for rubble. So I have to give them a unique specimen ID number. So I will do that. Okay. So it may take you a couple of times to get your data file just right. Specimen source for this person, specimen source. Oh, look at that. This is Acula. It has capillary whole blood for the specimen source. If we go back to Acula, specimen type for Acula can only be nasal swab. Nasal, SW. SW. Okay. And then I need to give them each a unique specimen ID number. I'm just going to make one up here. Make sure I record that into the my logbook if I have one for some reason. Save this. And we'll try again. Hopefully this will take it. Oops. Chose the wrong file. Problem. Might be part of the problem. Unsuccessful. No. Maybe I didn't. Just truncated the words. It successfully uploaded the CSV. So we can, once again, we can go here and we can look for just one of them. We'll look for Betty Rubble. Wow, these people. We have lots of results for Betty Rubble, it looks like. And I know that the one was 312, 1112. Let's go to ID 15. Actually, I don't remember what the date of the test was. 4/1, I believe. Here. So we're good. They did indeed upload. So that is how you correct your file and upload an unsuccessful file. So thank you for watching this video on uploading a CSV file of point of care test results to the NHSN POC test reporting tool. We hope it was helpful to you. Please send any and all related questions to nhsn@cdc.gov with CSV upload of POC results in the subject line. Thank you.